I think you're on mute this time, Luis.
Thank you very much, Tom. Definitely what CED has accomplished throughout its global network and collaborators and board has been inspiring for many countries to do more and to share their knowledge, especially during this critical times. So my question is, how do we get involved? Well, how people can get involved with CEDs, with what CED has been going on?
Well, thanks, Luis. I know, you know, I threw a lot out here, but hey, I'm going to have you answer since you're our social media and communication guru. Take it away, brother.
Excellent, thank you. So how can we get involved? Well, first of all, you would have to register and connect. In order to register and connect, we have two main registration forms that you can reach out in the information in this presentation that we will be sending to you guys by email, and also we will be sending it, we will be collecting it and put it in on our website under the webinars and courses section. So first of all, we have a newsletter that has been sending out monthly basis, where we include important information about how we can grow as clinical engineering professionals. And this is really important because we include not only webinars, but also success stories for clinical engineers and also good practices that have been shared by our colleagues in our global and worldwide network. And second of all, we have this great initiative that is called Hacking Coronavirus, where we send every day on a weekday basis resources that have been validated and that have been checked and also have been vetoed by our leadership and also by other clinical engineering division collaborators as well. And you can register there on our Hacking Coronavirus submission form as well and newsletter. Next slide, please. Also, you can share and contribute. We have this Diamond Global Clinical Engineering Journal that is open access. You can register there to submit your work. We know that you've been doing hard work on keeping technology feasible, safe, and available, and we want to share that knowledge with other professionals. So the Global Clinical Engineering Journal is a great way to share your work and contribute to our international network of clinical engineers around the world. And also, you can share also great resources that have been promoted in your country. For example, let's say relevant news that was published in some newspaper that shares an inspiring story about clinical engineering professionals, or maybe there's some regulation going on in your country that you would want to share with these 6,500 people that receive this newsletter on a weekday basis. Next slide, please. And last but not least, you can attend and participate. You know, we have the 4th edition of our International Clinical Engineering and Health Technology Management Congress. The first one being held in Hangzhou, China. The second one in Brazil, Sao Paulo. The third one in Rome, Italy. And now we are going to go visit Mickey and Minnie Mouse at Orlando, Florida, to share all of the good practices and works and presentations that the clinical engineering professionals have done around the world. It is a great opportunity to network and also get to know people that have been working on clinical engineering throughout the years. And it's an excellent opportunity to share your work as well. Maybe you're working on something that is very, very relevant for other countries or other professionals, either working on ministries of health or either working on hospitals, clinics, companies, etc. So we want to use this space to share those success stories, share your work. And I will also be introducing, well, Tom helped me introduce Dr. Yadin and Kelly that will talk to you about more about the Clinical Engineering Journal, and also you can share your work in there. So that's the way that we can get involved with what Clinical Engineering Division at IFMBE is doing. Back to you, Tom.